So I introduced myself earlier. My name is Wendy Walker. I'm the Chief of the Social Development Thematic Group here at ADB, and I'll be moderating the session this afternoon. I just want to also mention that this session is being live streamed, and you have the live stream link on your telephone, so you can, or on the app that you've downloaded, so please feel free to do that or to pass it on to others. This session is really to begin to open up a door in an emerging area and to raise some of the issues behind what we've been hearing throughout the course of the conference, which is on the importance of demographic change that's happening here in this region and the need to adapt and prepare for that across all sectors and across all areas, including social protection. So our effort today will be to try to define what some of those connections are. The title is Social Protection Implications of Long-Term Care, Lessons from the Region and Beyond. And this being a relatively new area, the emphasis on lessons and learning from elsewhere is really very important. So taking the life course approach, the session will make the links explicit between aging, care, and social protection and provide examples of how these issues are gaining ground amongst policymakers in the region and beyond. And we're going to take a slightly different format to this. We have 4 panelists and 1 speaker. And the speaker is Zenia Shiel Adlung, and she's going to make a presentation first, about 25 minutes, taking us over all of the kinds of connections and laying out the path. And then we're going to have a conversation up here among the policymakers and participants about the different ways in which these countries have been addressing the change. And the 4 countries are Japan, which has been moving down this path for a long time, Singapore, which is also facing things and moving very rapidly, in Thailand, which has been trying to shift itself and continue to shift, and then Indonesia, which is really also moving very rapidly and trying to set the whole policy agenda and see the future, as Dr. Maliki was saying earlier today. So without further ado and without further contextualizing this, I'd like to introduce the 5 panelists that we have. The first one is Zenia Shiel Adlung. She's currently the UN representative for Geneva at the International Federation on Aging. She's currently working as an independent expert on global health and long-term care policies, a lecturer at various universities in Germany and Italy, academic referee, and mentor for young professionals. But prior to this, she worked for many years as the senior ILO health policy coordinator in the International Labour Organization in Geneva and head of the division in the Ministries of Health and Social Affairs in the federal government of Germany. She started her career as a researcher at the universities in Munich and Berlin, where she received her PhD. So thank you very much, Zenia, for joining us. I'm looking forward to your presentation. If you'd come up. The second participant is Rie Sato. She is the Deputy Director for the General Affairs Division and Office for Dementia Policy at the Ministry of Health, Labor, and Welfare in Japan. She works in the long-term care insurance system of Japan and is engaged in developing and promoting dementia-friendly policies. She has vast experience in working with Asian countries to implement the international cooperation projects responding to aging society. So has a very good understanding of everything that's happening in the region, right? If you want to come up. And then we have Titus Lee. And Titus is the Director of Aged Care Services at the Age Planning Office's Ministry of Health in Singapore. He started his career with the Ministry of Trade and Industry and joined the National Population and Talent Division in 2010 to work on marriage and parenthood-related policies. He's moved on since then, working on enhancing the employability of low-wage workers and deepening capabilities in career transition services for displaced workforce before recently joining the ministry in 2015. Where his work focuses on healthcare financing and improving aged care services. So thank you very much, Titus, if you can come up. Next, we have Wororan Plikhamin from Thailand. She's the Director, Social Development Strategy and Policy Office at the National Economic and Social Development Council, Thailand. She has played a pivotal role in supervising the division's tasks, including analyzing internal and external factors that affect Thai society and putting forward relevant policy recommendations, particularly to the cabinet. She's currently leading work on the 20-year National Population Plan of Thailand, ensuring that all related information is at hand. And as Secretary of the National Committee and Subcommittee, she has a coordinating and facilitating function in the evaluation of government policies at both national and ministry levels. If I can ask you up. And finally, we have Dr. Maliki, who you've met in a couple of sessions, but he's the Director of Population Planning and Social Security at the Ministry of National Development Planning, National Development Planning Agency, Bapenas. He's been working there for more than 20 years, and he has an undergraduate degree in engineering, but his doctoral degree is in economics and population from University of Hawaii. He's working closely with the East-West Center for Population and Social Policy Issues, and he's currently appointed as director. And his portfolio is to design policy planning for development of social protection systems in Indonesia. Specifically, they are working on formulating the roadmap for implementation of national social insurance system for both labor and health. And this roadmap makes sure that in 2030, everyone has access to the social security system. He's also one of the people who are really leading on the development of the National Strategic Plan on Aging, and a lot on, and within that, on long-term care. So Maliki, may I please ask you up here? So we have a pretty distinguished group of people who are both policymakers and really very forward-thinking. And trying to, and what we want to do is to share as much experience as possible across this region and beyond. So with that, I pass over to Zenia for her overview.
Thank you very much, Wendy, and good afternoon to all of you after a very good lunch. Thank you for coming back, and thank you for inviting me to this important event. It's a pleasure for me to talk to you about social protection implications of long-term care, and I will highlight some lessons from the region and beyond. So I have to check out this. Oh, it works. I would like to focus on three main questions. First of which is, why do we need to discuss on long-term care? What is the issue? Secondly, what are the global and regional experiences with long-term care protection for older people? And finally, which policies could address the issues in the Asian and Pacific region? So why do we need to discuss long-term care? It is important to be aware that 53% of the global population that is aged 65 or more is living here in Asia. And if we look at the life expectancy at age 60, we find that it is exceeding 20 years. It is going up to 26 years in Japan. It is 25 in Australia. And the lowest life expectancy we have in this group is in Mongolia and Myanmar, and it's still 16 years. So we have a very high life expectancy at age 60. And this involves very complex health conditions. Many of you are medicine doctors, and I don't have to explain why this is like this, but it requires not only more long-term care for more older people, but it also requires a higher quality for a longer period, because people are living longer of long-term care. And it requires supporting environments for daily life, not only at home, but also in cities and in public places. But before I go into more detail, let us briefly clarify what we are talking about when we speak about long-term care. First of all, let me point to the fact that long-term care, such as health and social protection, is a human right. So we do not only talk about a cost or a burden, we talk about a human right that is available or should be made available for older people. Usually, long-term care is referred to as a range of services and cash benefits that are addressing the reduced physical or cognitive capacities of older people, such as eating, bathing, dressing, and so on, and it is provided at home or in institutions such as nursing homes. It is given to people that need long-term care because of, for example, chronic diseases, non-communicable diseases, multimorbidity, and geriatric health syndromes such as frailty and falls. So, which social protection benefits are the best to address long-term care needs? At the global level, we can distinguish three types of benefits: benefits in kind, benefits in cash, and benefits for family carers. Benefits in kind include, for example, medical or social services, but also prevention, for example, of diabetes over the life course. These preventive services are very seldom, and particularly when they focus over the life course, we find them only in very few countries within the health systems. The medical and social services are usually delivered either through health or long-term care schemes. Benefits in cash and benefits for family carers are provided for in very few countries. But nevertheless, they exist, and they are given through social assistance, health, or pension schemes, and consist, in the case of cash benefits, of a fixed amount of money that can be used to buy privately care services, be it from the formal or from the informal sector, and to create enabling environments at the home. And benefits for family carers, as we find them at the global level, include, for example, social protection coverage of family members, or leave, unpaid leave from work, for example, that is then replacing the otherwise leave from or unemployment that would follow if the person is not able to work anymore. I should mention that in all countries, long-term services and benefits are very limited, much more limited than health services. They are nowhere covering the full costs that occur to the persons, because this limit requires people to pay the rest privately, and these limits are usually stated within legislation. So it is a requirement for co-payments as a financing mechanism. Further, benefits in all countries involve rigid eligibility rules, so the needs test is very strong, so that lower requests for needs are not covered. And in addition, in many countries we find income and means tests. And as a result, of course, you know this, services are targeted to the poor. Another issue that we observe at the global level is that long-term benefits and schemes are often mismatched with other social protection schemes such as health or pension schemes, and lack lifetime approaches and also integrated care and person-centered care is not really existent. So these benefits are provided through social protection schemes, as I mentioned already. And the main types of schemes that we can distinguish are those that we have discussed already in other sessions, namely social insurance and social assistance schemes. In terms of social insurance, we have specific long-term care insurance schemes, but also health and pension schemes that might be used to deliver services and benefits, and they are financed through contributions, but, and this is very specific for long-term care, also through co-payments that are stipulated in legislation. So co-payments are used as a financing mechanism and not as a control mechanism to limit the costs. And this is very difficult. We will come back to this. And it is also applied in social assistance schemes. Even though they focus on the poor, we have high co-payments that are requested from the poor to access services that are provided. Examples for long-term care are, for example, here in the region, Korea and Japan. Beyond it's Germany or Austria. Social assistance schemes here are in China, but also in Russia and Sweden. And then we have a third group, which is a mix of both health and social assistance schemes. And also here we have, of course, the co-payments, and this is the case in many countries, such as in France. And the key characteristics and key principles of all these social protection schemes that apply usually refer to universal coverage based on national legislation, so not just a little bit community care here and there. There should be national legislation to have equal access to adequate benefits. Then financial protection of the persons in need, solidarity in financing, so broad pooling, and equitable access to quality services. So let us see how countries match these principles. How many people live in countries with universal long-term care coverage? Here you see the percentage of the global population aged 65 by long-term care coverage. And as you see, only 5.6%, the dark blue share, live in countries with universal long-term care coverage, such as in Japan. The majority of people, 300 million by the way, or 48%, are living in countries without any rights to long-term care. And then we have a group that lives in countries with means tested that forces the people to become poor before they become eligible. And this is very soon, very fast in many countries, because co-payments are so high that they quite have an impact on the impoverishment of the older population. Mostly concerned are older women, because they are the biggest group in this need for long-term care group. Then we have concerning singles, older singles, and the very old, of course, and the older poor. So what about solidarity in financing? Is public funding for long-term care sufficient throughout the world? Here we see the percentage of the population 65 and more excluded from access to long-term care due to deficits in public expenditure. So there's just not enough funding available that everybody in need can have quality services. And the countries in red refer to very high deficits, and that means that more than 75% of the population aged 65 and more is excluded from access to services due to the lack of funding, public funding. And this includes a large part of the population in Asia, and countries are both rich and poor. So it's not a question of rich or poor countries, and it is independent from the legislation, from the existence of national legislation. So apparently governments are just not implementing correctly where they have legislation, the laws, or they are too restrictive with the public funds that are underlying or necessary for the implementation of the legislation. So what are the impacts? Are long-term care services affordable for all the persons in need? And we find, of course, as expected, that countries without national legislation have the highest affordability issues. 100% and more of total long-term care expenditure is private in countries such as India or Mexico. But still in countries with means-tested schemes, given the high co-payments, we find a high impact on out-of-pocket payments, and home-based care, for example, in Australia is 100% out-of-pocket. And even in other rich countries like France, we find that out-of-pocket payments can exceed disposable income. So there is a high impact of out-of-pocket payments. The least important out-of-pocket payments is in countries with national universal legislation, but still we have these co-payments, and 10 to 25% up to 100% in specific cases is the rule. So globally we can say that out-of-pocket payments or high affordability issues occur throughout the world, and this is due to gaps in coverage of legislation or due to high co-payments that exist when you pick up or want to access long-term care services, because they are stipulated in national legislation and because of the unavailability or the low quality of public services that force people to go to the private sector. And of course, this results in a misuse of expensive health care in hospitals. People go there to save money. It results in inequities and impoverishment. Another issue that we have to discuss relates to the availability of formal long-term care workers. Are they sufficient to provide services, quality services, to all in need? And here you see the estimated regional long-term care workforce shortages. And at the same time, you can say this is the job creation potential for the countries, for the region. If they would invest in long-term care, they would have this additional advantage, not only caring for older people, but also stimulating the economy. And as you see, in Asia and the Pacific, we find the highest number of long-term care workers that are missing. 8.2 million of formal workers are missing in the region because it is so much advanced in aging of the population. And this translates, for example, to the fact that in China, 1.1 worker per 100 population aged 65 and more is available. So I don't have to explain how big the deficit is. Everybody can see this. And we have estimated here in this calculation a minimum of 4.2 for 100 persons aged 65. This is already a very little minimum, but 1.1 is just below this. The same applies in other countries such as Russia, where we have less than one person, and in South Africa we have less than half a person for 100 people aged 65. So who fills the gap? The gap is filled by often unpaid female family carers or informal workers and migrants, which are in law or in praxis not or insufficiently covered by formal arrangements, and these are working contracts or social protection coverage and so on. They make up to 80% of the total workforce that is delivering the services to the people in need. So what to conclude from the high reliance on family carers for providing long-term care? Obviously, aging in place is the most important and most preferred form of long-term care, and it should be like this. However, if it is only and exclusively provided through family carers, we should be aware that it's not sustainable and that it has a high cost. It's not for free, as many politicians think. So sustainability of such a solution is very much threatened by the fact that families are shrinking and less family carers are available in future, And this little number of people which is available is also aging, so the aged care for the older people. Further, we have changing gender norms. We have the fact that younger generations don't live at home but abroad. But we also have an issue that is seldomly discussed. It is the fact that family carers have to work without income, and they have no social protection, and they have no opportunities to have savings for their older life, so they have a high risk of impoverishment themselves if caregiving requires reducing to give up the job. Also, we find that the absence of decent working conditions, so no wages, no time, no holiday, no occupational safety, is a key issue for family workers. But not only family workers are facing problems and challenges, it is also the recipients of carers, of people who need care as well. They, without professional quality services, might face increased levels of dependency in their mental and physical status because they need quality services in many cases. Let's speak about people with Alzheimer. Can everybody treat his or her mother in such a condition? Often, this results then in something which is usually not mentioned in public discussions, a taboo to be open. This is the abuse and violence against family members that we observe more and more. It's statistically very relevant in most countries due to the burden of caring for family members and without having the professional skills and training that would allow to know how to correctly and professionally work with these problems. Finally, there is also a social economic cost involved that is hardly discussed. We speak about often the fact that family care is for free, but no, we should see the foregone economic growth that is coming out of the absence of family carers from the labor market. This is a very huge number, as I have shown before. The foregone employment due to the lack of skilled long-term care workers, which could contribute to the GDP and economic growth as well. The higher public expenditure that is developed through the absence or the development of impoverishment of family carers, and then increased income and gender inequalities, for example, between carers that can afford to give up their income and those who cannot. And then we have, of course, the failure to comply with labor laws. Against this background, it is important to address in all countries at least three main areas in long-term care that enable, first of all, people to age in place, that mitigate the costs for older people, and that rely less on family carers while, of course, supporting them. And this requires policies that are in the area of social protection, which we discuss here a lot, but also in the development of the workforce, in enabling labor market policies, and in making institutional and community care more acceptable due to rising quality standards. Let me look a little bit more specifically in the policies, social protection policies, that are required to achieve these progress developments. First of all, it is, of course, necessary to provide universal coverage and close gaps. This means also matching and adjusting existing social protection schemes with long-term care needs, providing benefits that are people-centered over the life course, such as in health, in pension, child, maternity, and so forth, but also to review the employment requirements that are necessary to have social protection entitlements, and ensure that means testing is not excluding people who have needs. Further, it is important to minimize out-of-pocket payments to reduce impoverishment and provide access to accessible services at the community level. Finally, we have spoken about the family carers, informal carers and migrant carers that have such a high, that are such a high group of caregivers, and they should be supported. They need support either through cash benefits, which we mentioned at the beginning, or subsidies for social protection benefits, or they could also be supported by unconditional social protection benefits, which could be given to them through whatever scheme or system. And of course, we know already that the portability of social protection benefits, for example, for migrant workers, is an important issue. However, it is also important to look beyond social protection policies and apply a whole of government approach to be successful. And this would require from the head of government to prioritize long-term care needs and coordinate fiscal, social, health, labor market, and other policies with a view to have a positive result for the older people. The Minister of Finance is requested to develop fiscal space for investments in jobs and ensure adequate public funding for benefits. This might require setting up enabling macroeconomic frameworks. We can discuss this in other sessions. Finally, the Ministers of Health, Labor, and Social Welfare should not only look into social protection policies, but also look into the long-term care workforce shortages and provide enough jobs, decent jobs, and training to develop the workforce to a limit that is sufficient, and develop an employment status, as we have said before, for the informal workers. Finally, it is necessary to address gender issues that occur due to the different lower levels of employment, interrupted employment of carers, and the wageless caring that is requested. Thank you very much.
Thank you, Xenia, for that very rich and dense, but full of interesting examples on the relationship of social protection and long-term care. I'm now going to, Xenia raised so many different issues, and I hope that you get a chance to download the presentation because it really contains a lot of information inside of it. But I want to try to begin to probe by actually probing our other panelists and understanding a little bit more about how things are actually working and what are some of the challenges and benefits of the different approaches that countries are taking. So if I can move first to Ms. Sato from Japan. You have been playing a very big role in the development of the long-term care insurance system. It's one of the main things that Xenia raised up front. It's one of the few countries that has actually achieved universal coverage. You started developing it about 20 years ago. It's been going through a lot of changes, and changes are not just in terms of the insurance system, but the actual service delivery, the whole system side. So I was wondering if you could give a little bit of a outline of that long-term care insurance system for people here, and also talk about what are some of the benefits and challenges and changes that you anticipate going forward.
Okay, thank you very much. I'm Rie Sato from Ministry of Health, Labor and Welfare, and I'm very happy to be here today and share some experiences from Japan. Let me briefly explain the background and the basic structure of Japanese long-term care insurance system. In the past, Japan had both universal health coverage, which was achieved in 1960s, and social welfare scheme for older persons operated by national tax. At that time, it was natural that younger family members, such as sons and daughters-in-law, take care of older parents, and the social welfare system mainly focused on the poor or people with no family. But in the course of population aging, it has become very difficult for only family members to take care of older persons. And as a result, in 1980s, so-called social hospitalization had become a very big problem all over Japan, which means that many older persons were admitted in the hospital for a very long period, even if they didn't need medical care due to the lack of the services, welfare services. And it was a huge burden for national medical costs, and also it was very bad for older persons' welfare, just taking medicine and lying on bed all day, something like that. Then there was a very big discussion during 1990s, and finally in the year 2000, we introduced the long-term care insurance system, which is to support older persons by a society, not only by a family member. And the basic structure of this system is the social insurance system. The major reason to adopt social insurance is that the relation between benefit and contribution is clear. People pay premiums in advance, and then in case they need the services, they can use them. And I think that's why it was acceptable for many of Japanese people at that time. And the financial resource is the premiums collected from people aged 40 and above for 50%, and the tax based for 50%. And I think one of the characteristics of Japanese system is that it's operated by municipal government. And the insured persons, namely people over 40, can use the services when they are certified by municipal government as they are in need for care, and have to pay 10% of the service fee as an out-of-pocket payment. The amount of premiums are decided based on the income level. As for people over 65, the premiums are basically deducted from pension. On the other hand, the premiums from 40 to 64 years old are collected together with health insurance premiums and then put at the national level and distributed to each municipality. And the disparity among municipalities in terms of aging rate or average income is adjusted by national tax portion. And out-of-pocket payment can be 20 or 30% in case the insured person's income is higher than certain level. In addition, there is a ceiling of out-of-pocket payment for lower income group, and the amount exceeding that ceiling is reimbursed to them. Regarding a coverage of beneficiaries, Japanese long-term care insurance system focusing mainly on the care for older persons, and we have separate welfare scheme for persons with disability. As for people over 65, they can use the services when they need care by any reason. On the other hand, people between 40 to 64 can use services only by specified diseases, several age-related diseases like terminal cancer or early onset dementia. Finally, let me touch upon service provision. We cover both in-home care and facility care. Those are all in-kind services, and we don't have the cash benefit. There was a discussion whether we should include cash benefit or not when we started the long-term care insurance system, but it was decided not to include because that kind of benefit may result in forcing family members to stay at home, family carers to stay at home and continue to take care of older persons all day instead of utilizing the professional care. Then I think introduction of the long-term care insurance system contributed to increase the service provision dramatically, especially the service providers of private entities. In Japan, the service users can choose and combine the care services on their own, and there are professionals called care manager who can assess the condition of the older person, advise which services to take, and coordinate among the stakeholders like medical and social professionals. Okay, that's all for overall situation in Japan.
Thank you. Thank you for a quick summary of a very complex system. Now, as you go forward, as we heard in the previous session, that the scenario for Japan going forward over the next 20 years continues to increase the demand for long-term care services. So what are some of the key trends that government is thinking about? What are some of the key trends that government is thinking about and changes in policy to be able to support and meet that increased demand?
Okay, thank you very much. Actually, Japan is already super aged country where its aging rate or percentage of population over 65 reaches 28%. And it's still on the rise toward the future, reaching 38% in next 40 years. And especially the rate of old, over 75 or 85 and more will be increasing very much from now on. Of course, the risk to be in need for long-term care rises as we get older. So it means that Japan will face more and more long-term care needs for coming decades. And considering this situation, now we focus on community-based integrated care system as our most important policy toward 2025. This policy aims that the older persons could live the rest of their lives in their own ways in the familiar environment, even if they become heavily in need for long-term care or they are diagnosed as dementia. In other words, aging in place. To realize this concept, we think there are 5 important elements, namely medical care, long-term care, housing, livelihood support, and prevention of long-term care. It's important these elements are provided in an integrated manner with good collaboration among professionals as well as the residents. Actually, even we call it system, it's not a fixed nationwide system. As the situation is totally different from region to region, we expect it's promoted in various ways in each community by initiatives by the municipalities. And long-term care insurance system has focused more on the professional care since it started. But under this policy, we are trying to promote mutual support in the community. There are many things to support the older person's daily life, not necessarily requiring the professional support, like support of shopping or taking garbage outside and so on. So we promote to use grassroots activities by NGOs or residents groups in order to fulfill this kind of needs. That's a brief introduction of the community-based integrated care system. And next, I'd like to mention our future challenge. Toward 2025, we are trying to respond to increase of older persons, but as you pointed out, after 2025, the decrease of the working generation will be more serious problem for us. Even now, many of the long-term care facilities or service providers are suffering from labor shortage, And we are conducting several measures like improving working condition of care workers and promoting foreign human resources to come to Japan as care workers. Besides these efforts, we have two directions of policy as a longer period strategy. Simply speaking, one is to decrease the long-term care needs, and the other is to provide care with smaller number of workforce. And first one is mainly achieved by extending healthy life expectancy or promoting healthy aging. And we aim that older persons can reduce the risk to become dependent and live a healthy life as long as possible. As one of the measures, we promote to set up many places where the older persons can go regularly, like weekly exercise class. Those activities can be good for keeping their health and also good to maintain network among residents, eliminate social isolation, and then we are expected to prevent them from being dependent. And the second one is improving productivity of long-term care services. The use of technologies like robotics, AI, or ICT will reduce the burden on workers. Okay, these are our new challenges.
Okay, thank you very much. So still a lot of dynamism and change in the system in Japan. One of the things that Zenia also mentioned was or concluded was really how this needs to be a whole of government approach and the absolute need for coordination. So I think there, Singapore provides us an interesting example. Titus, you're coming from the Aging Planning Office. It's been one of the critical institutions on reframing population aging as a positive trend in the country, and it's outlined in the government's action plan for successful aging. So can you talk a little bit briefly about the government's approach and what the role of your institution is in both coordinating and helping to build that whole of government approach?
Hi, good afternoon, everyone. I'm Titus. I'm from the Aging Planning Office in the Ministry of Health. And maybe just before I start, I'd like to share a story about a hospice that I visited earlier this year. So earlier this year, there was a hospice that opened, a new day hospice, and they had an exhibition of some photographs they had taken of their hospice patients. And the title of the exhibition was A Good Day. So it was very interesting to me when I visited this exhibition that most of the photographs were about seniors doing day-to-day things, and that's how they defined it being a good day. So it wasn't them doing something very different or out of the norm, but actually something very usual, like having biscuits with their coffee, having dinner with their family members, going to church. And that actually is the key direction that the Ministry of Health is also trying to take. We want to support aging in place, and aging in place actually means helping seniors to do what they like to do on a day-to-day basis in the community. And actually all our initiatives, our schemes, aim to help seniors to age in place. And the direction of the Aging Planning Office is to work together with other agencies across the island to put support measures in place to support seniors so that they can age in the community rather than age in an institution. So just to share some of our plans, in 2015 we developed an action plan for successful aging, and the plan covers 3 big areas. So the first area would look at the individual senior, and what we hope to do for seniors is to allow them to continue to lead meaningful and productive lives even after they retire. So for a lot of seniors, after they retire, they end up spending time at home, or in Singapore's case, in the coffee shops, just drinking coffee. But a lot of times they could do many other things. For example, start a new business or try something that they haven't done while they were still working. So we put in place a lot of causes for seniors to take part in and to help to perhaps find a new area of work or even a hobby that they could do to spend their time more meaningfully as they age. So that's one area that we've been doing. The second area is to build a community that supports seniors. So in Singapore's case, we do have some communities where we have placed resources about dementia, where we have dementia help points to allow the community to support people with dementia. If we find that a senior has left the home and started wandering the streets, the community can also get together to identify the senior and to inform the family members where the senior has been. So that's another way that we are building the community in Singapore's case. And the third area that we are looking at is to build a city that supports seniors. So a city that supports seniors would have the right infrastructure. Just today, I saw in my news feed that a foreign visitor who came to Singapore was very amazed that our traffic lights have a device that allows seniors to tap their passes. And what happens is that the traffic light will give the senior a longer time to cross the road. So it's some small innovations like this that help to make the city a more friendly place for seniors. Of course, the other big area that we want to support seniors is seniors in would be in long-term care. And that's where my office takes a hard look at the capacity of long-term care, the affordability of long-term care, and the quality of long-term care. So that broadly sums up the direction that we hope to take in Singapore's case.
Thank you. And one of the interesting things about Singapore also is that government does not expect to deliver everything by itself. So it also works a lot through voluntary associations, through private businesses and other. Can you explain a little bit about the way that you see those types of collaborations and the sorts of incentives that you build in the system to be able to support that, and how as government you're trying to lead in the development of the sector?
So this is a very interesting question, and I do have some colleagues in the audience who are from a voluntary welfare organization. That's the equivalent of the NGOs that we have in Singapore. In Singapore's case, we don't just look at aging as a whole of government issue, but it's a whole of society issue. So we work with partners who are non-profit organizations. We also work with partners who are for-profit organizations to roll out services. And one example is how we roll out services in long-term care. So for example, if we wanted to build a new nursing home, in some countries, we would just allow the private sector to build a nursing home and to charge the seniors who use the service what it would cost for the whole development. But in Singapore's case, what happens is that the government has a special scheme where we come up with the costs of developing the infrastructure. So we pay for the land and we pay for the development cost of a nursing home. And what happens is that we call for a competitive bid for non-profit organizations, for private organizations to come and bid for the operating rights of such nursing homes. So this helps to lower the cost of service provision because the development costs have been taken up by the government, and the operators have all they have to do is to focus on providing good quality care and affordable care to their clients. So this is not just in the nursing home sector, but also in other sectors like center-based care or home-based care, where we use competitive forces to help drive down costs as well as to improve quality.
And we've been watching and seeing that Singapore recently changed its pension age, and then it's also done a lot on long-term care worker policies development in the last couple of years. So what's next?
Okay, I would say that there are three big areas in the aged care space that we are thinking about. One big area would be to support family caregivers. So I know there's a bit of discussion about whether that's a sustainable model, but in the Asian context, I think a lot of people do feel that taking care of their elderly parents is a duty, or it's something that's very important to them, and they find a lot of meaning doing that. So even if it's not an entirely economically sustainable model, what the government is trying to do is to provide more support to caregivers in certain areas. So one would be, of course, in the financial aspects, and we are looking at how we can provide more grants to offset the cost of caregiving in the community. The other aspect is, as mentioned, caregivers also need time to take care of their own commitments, to go on holidays, to have some rest. And what we are looking at is to also develop respite services. So we've noticed, for example, that for some elderly seniors who have dementia, they have sundowning syndrome and they can't go to bed at night. So we are looking at perhaps having a night care service where dementia clients who can't fall asleep at night can spend the time at the center while their caregivers at home can rest. So it's initiatives like this that perhaps help to give more support to caregivers that could relieve the burden and help them have a longer caregiving journey. So that's one big area. The second area is integrating social and health. Aging is not just a healthcare issue, but it also involves ensuring that our seniors are active, they are well mentally, and we are looking at various ways to integrate that. So just recently, we took over some of the functions from the Ministry of Social and Family Development and moved it over to the Ministry of Health so that we can integrate the functions better across the ministries. And the last area would be similar to what Japan is facing. I think we do have a very small workforce, and we do need to make sure that everyone in our workforce is working productively. So we have to tap on technology to enable the workforce in the long-term care sector to deliver more. And we do learn a lot from Japan in such areas, learning about how they use technology to enable their workforce in this regard. Yeah, so this would be the 3 key areas.
Okay, thank you. Still a lot more coming down the line. Warren, so we just heard from 2 super age societies, and in the next 20 years, Thailand will be in the same situation. So what kinds of things are you doing in your national development planning? What can we look for in your strategies going forward that shows the type of, the ways in which you are also trying to adapt?
Thank you. For Thailand, Thailand will go into be a super age society in the 2021, and with the comparison of the 20% of the older person, and this proportion will be the 30% in 2036. So that's why we have to prepare the policy to handle it. At the national level, now Thailand has a national long-term strategy for 20 years, and it's begin at 2018 last year to 2037. And for this national plan, that is the first time that we have a long-term plan like the 20 years. And we still have the national plan, that is 5-year national plan, that is called the National Economic and Social Development Plan. And this plan is kind of like a cascade from the first 5 years of the national strategy to the national plan for 5 years. That is the guideline for the ministry to do the action plan. And they can like a cascade the strategic issue from the national plan to do the action plan. And I'm going to talk about just the national plan for the 5 years because they have like 10 strategies. And 10 strategies is related to the aging implication. I just want to say I just want to take some example for the strategy. For example, the strategy, the first strategy is called strengthen the human capital. That is the guideline for the improving the elderly care system. That we have some like a guideline a little bit about the improving the elderly care system. For example, to push forward the long-term care legislation and to develop intermediate care. And the final for the improve the elderly care is to develop the medical technology and innovation to improve the health and well-being of the elderly. And we have to promote the age felicity under the concept of the universal design. That is the guideline for to improve the elderly care system. And we also to develop a kind like to increase the aging society the active aging into the labor market. And we have to develop the working skills and to promote the monetary and fiscal incentive to encourage more employment for the elder people. And that is the first strategy. And the second strategy, we create social justice and to reduce the inequality. that we have some about the OS allowance, but we have to increase our OS allowance just only for the poor group. But now they have like a OS allowance around $20 per month, and it depends on is that like if you 60 you get 20, if you 70 you get 30, something like that. And the third strategy is about to strengthening competitiveness, and we have to develop a new financial innovation for the elderly to guarantee the retirement income after they retire. And we should promote to create the business or niche market for the elderly, because it's the big market for this group. And the last strategy, we focus on the advanced infrastructure and logistics, that we have to design a new infrastructure and improving the existing infrastructure under a universal design. That is the strategy in the national plan for 5 years.
Thank you. So the strategy contains many different types of policies to actually support an aging population. But what specifically in social protection policy development is happening in Thailand? And also maybe if you can explain a little bit about the big national program which you have rolled out over the last 3 years.
Okay. For the main policy for the elderly, we have lots of policy for the elderly. For example, we have, like I said before, we have an OS allowance. And for the employment, now we have we have to encourage the private sector to hire the older person, that we have using the tax incentive, that you can reduce the 2 times expense of the OS salary. That is the incentive to have the active aging to be in the labor market. And we still have the OS fund, that is the loan for the elderly to start a business as the individual or as a group. And we also have the learning of the older person, that we have a school for the OS to kind of like a lifelong learning. They can learn a lot from the skill life or something like that. And for the care provision, I think this is the main project of the government, that is called the community-based long-term care program. That let me talk about this for the core principle first, because this provide the integrated social care and health care together, and this is run by the local authority to manage this program, and this is cooperate between the local authority and Ministry of Public Health to promote the healthcare service. And the financing mechanism is from the National Health Security Office, that is take care of the 30 baht scheme or the universal health coverage, that is allocated to the local health fund, that is to manage this program. And there are besides the Ministry of Public Health, there are the primary care unit to help this program, to run this program, like a home visit, and they have a PNP measure, promotion and prevention measure to prevent the long-term care system, something like that. That is the huge program in my country.
Thank you. So a big program having been developed and a different approach to financing than in Japan. So Maliki, now if we turn to you, from Indonesia, not as fast aging, but going to end up with a very large older population eventually. And you are a big part of helping to prepare for that future and a big champion for long-term care within Indonesia. So why do you think it's so important in the context of Indonesia, and how are you going about building momentum for this progress?
Thank you. I guess in my earlier presentations, I mentioned that we are going to be an aging society next year. So we have 10% of the populations older than 60 plus around next year, And then in the absolute terms, we have around 21.6 billion in 2019 of the elderly. And we are looking forward for around 61.4 million in when we celebrated like 100 years of the population of our independence. And also our challenge is the diversity of the aging populations. While we are looking forward for a few more years to be aged, but some of the provinces already have an urgent need for says like a care for the elderly, because there's a lot of like a rapid urbanization as well, especially in Java Island, that makes a lot of like young people going to the city and also left the elderly in the hometowns. And there's so many people who like increasing elderly who live alone, especially for the women elderly. So in terms of the life expectancy, the difference age, the difference life expectancy between the men and the women is around 6 years. So the women live longer, they stay at home, they stay in the rural area. And they also had, there's also an increasing tendency that the women elderly lived alone. Around, I think this is a quite striking, significant difference between the men and the women who live alone at home. So it's like around 16% for the elderly women, and then the men itself is living alone around maybe 5%. Seems like if the elderly man already like left by his wife, he usually remarried, I think. Yeah. So they usually have they lived. Most of them live also with their spouse. Around 60%, 60 to 50 to 60% still live with the children, but usually they live under the different dwellings. So there is because of these urbanizations and also increasing tendency of the women who lived alone, also the elderly lived alone in general. In some cities, especially Yogyakarta and others, city, there is also a tendency that the elderly commit suicides, yeah, because they are feeling lonely, and they also have some like a chronic illness, but they feel lonely, so they decided to end their life. So this is one of our concerns, that how we can actually can protect the elderly from such kind of incidents. The other part is that the elderly, because of also doesn't have enough pension fund, the elderly is tend to be very vulnerable with the poverty. And there's also data that we have that around like significant numbers of the elderly themselves that they, especially for the women, they are indicated is immobile, or they have disability, so they cannot like work or live independently. So they really need to have a care. So this is quite urgent for us to have some of strategy, and we already like formulated as like also the same with the Thailand, that we have the national strategy on the aging population. I agree with Senia when you also pop up the questions on that, the questions of the definition of the elderly itself, that we actually have to prepare for the aging populations not when they are defined as elderly, but as early as possible, because to promote the healthy aging and active aging, we need to have like early intervention, especially like says like 1,000, start from 1,000 year 1,000 the first day of their lives, So this is the national strategy is like very comprehensive and integrated sectors area that we intervene with like 5 strategy. One of the strategy is actually to develop the long-term care itself.
And for that, because you're taking a whole of government approach, like Xenia said, in the development of the strategy and also in development of long-term care, But different ministries and different people often have different views and ideas about what is long-term care. So how are you going about trying to build consensus and clarity in what it is exactly that you're trying to do?
Yeah, I guess I agree with everybody is that actually the aging issue is not only the government commitment, but we also have to involve with the others, especially when we heard from the Japanese experience that long-term care, that the intensive financing scheme for the long-term care will really maybe will burden the fiscal government later on. That's why in terms of like development of the long-term care, we are in a very early stage that asking for commitments from all the stakeholders, not only from the ministry that I think we can count maybe around 3 main ministers, like Ministry of Social Affairs, Ministry of Health, and also the Family Planning Board, but also the other like supporting ministers, as well as the non-government. In this case, we have a lot of academicians, a lot of like NGOs, and the other, also the private, as well as the ADB too. I think ADB also support us for development of the system itself for the long-term care.
So thank you. So now we've made an enormous gallop through the region, through 2 very super aging societies who are working and building very strong systems, and 2 other countries which are also coming very rapidly in their own policy development. And the kind of institutional rethinking that needs to take place, the policy rethinking that takes place, and the pivotal role for social protection, and also for social protection ministries, because right now, existing systems, so many of them are actually the ones that are actually running the bare system that even exists right now, which is mostly focused on the poor and most vulnerable. So a lot of the discussion is about how to transform that, how to build broader coverage, how to develop stronger services, how to create whole new policies and new benefit systems, and also the long-term care worker. With that, I want to ask Zenia if you have any final comments that you'd like to make based on the discussion that we've had and reflection on your presentation, and then open it up to the audience for any questions. And thank you for finally resolving the problem with the microphone.
Yeah, thank you very much. I think it was really interesting, and to me it has shown that we have to come to really country-specific solutions, what as regards funding, but also as regards all the other aspects. But if there is some commonalities, I think maybe we should highlight 3 aspects. One of which is the revision of social protection schemes, which should be done with a view to better match and improve the coverage and the benefits, that they be needs-oriented and not lead to impoverishment. Secondly, I think in all countries it's also an issue with regard to developing the workforce that is needed. While family care is important and should be supported, definitely it is not enough, and we need to look into training and into decent working places, into such aspects. And thirdly, but maybe not less important, I think we should look into the question how to avoid age discrimination, how to ensure that older people are not seen as a burden or as a cost, but as an asset that is stimulating the economy, that is stimulating the society, and that is needed. And I think this is most important in order to get also the overall support for the positive development of this in the society.
Okay, thank you. So we can also pass around the microphones to anybody if you're interested, but maybe to take advantage of what we have here on the screen, Titus, I'll ask the first one to you. Can you share more about some of the whole of government approach, such as tax allowance, housing policy, and insurance that facilitates long-term care in the community or home?
I would say that one big policy that is coming up in Singapore is the introduction of a new insurance scheme called CareShield Life. And this scheme is to support seniors who are considered severely disabled, and the definition of severely disabled would be those who require support in 3 or more ADLs. What happens is that if they come on board this insurance scheme, they would receive a monthly payout to offset the cost of long-term care in the community. So this, such a scheme can only work when you have different agencies coming together. So the Ministry of Health, of course, has to coordinate and to drive the development of such a scheme because it pertains to long-term care. But we also need to work with the Ministry of Manpower that looks at retirement adequacy, because a lot of this funding for insurance policies will have to come throughout an individual's working life. And it's also part of the conversation that we look at how some of these long-term care insurance translates to other private insurance companies coming in with their own products to layer on top of the basic product that we provide. So that also affects the insurance industry in general. So such conversations often happen at the whole of government level, and it's useful for the Aging Planning Office to then take the lead and to coordinate. Housing policies, tax policies, they are all also coordinated through the Aging Planning Office. Another example would be, for example, elder care leave. Let's say a caregiver needs to take care of an elderly person. Today we don't have elder care leave, but we do have a situation where civil servants can take elder care leave. So in this regard, the civil service as an agency is taking the lead in Singapore to show that this is something that we can do to support seniors. Yeah.
Thank you. There's another question here which is relevant to everybody, because I think you might be taking slightly different approaches, and that is, what are some practical strategies to build capacity of unpaid caregivers? Some practical strategies to build capacity of unpaid caregivers. So it could be family caregivers, could be people working within the home. Practical strategies you're taking in your countries.
Well, I think Thailand tried to have the unpaid caregiver, but I think it doesn't work at all because it's kind of like a volunteer. And now we skip to the paid caregiver because it's kind of like to pay the caregiver and to take care of the elderly. We can to take care once a month or once a week, something like that. But it's for volunteer. We cannot do like that. So I don't think it's work in my country.
Maliki?
Yeah, I mean, we haven't got the strategy yet, but I guess when we count that there is like around 60% of the elderly living with the family, meaning that the informal caregivers or the family caregiver have to be very dominant here. So then we have to have some strategy. And one of actually my friend have to spend, says like 1 to 2 hours a day in the morning before she left the office to taking care of the bedridden parents. And what Titus already mentioned about the caregiver, the elderly leave. Yeah, the elderly leave is quite interesting. I think that is inspiring too. So in addition to the maternity leave, I think this one is also one of the potentials that we may propose to have it in the future in Indonesia.
And Ree, I think that Japan has done quite a bit even in your specific area of dementia care for family caregivers.
Thank you very much. Actually, compared with other countries, Japan focused on more on the professional caregivers, and we don't have any specific approach to the family caregiver or unpaid caregiver. But about the dementia issues, each municipality sometimes have the classroom for the family caregivers, what the dementia is like, or how to take care of the persons with dementia, something like that. And in addition to that, we have the program of the dementia supporters. That's for the community members or everyone in the society. to get the proper knowledge about dementia and support when the persons with dementia need something like that.
Thank you.
I just wanted to add on, because Maliki reminded me of what we're doing in Singapore. Even though we don't have elder care leave, something that we are trying very hard to do is to facilitate flexible work arrangements, and that actually makes a big difference to caregivers who may need a bit of time off in the day to take their elderly parents to the hospital to see the doctor. So even though we don't have leave yet, because that may be something that is more forward-looking, we do try to at least allow workers to have flexible work arrangements to care for their seniors. So I think that's something quite practical that we can do.
Okay, thank you. And here I want to ask one question which is also quite important for everybody to understand. So what are the pros and cons of family or community-based services versus facility or institution-based services?
In Indonesia, it's still quite strange to send the parents to the institutional-based facilities. So it's still out of range. So I guess the whole idea about the long-term care development system development here is that how we can focus on to strengthen also the family members on how they taking care of the family, as well as how the community can support the care. And for the other, I guess there is some portions of the elderly who really doesn't have family. Then it can be an alternative to have them in the institutions. But I think maybe also more to the community as well. Yeah.
Okay, thank you very much. Actually, ultimately, we don't care about the care is given at the home or at facility. We think even if the cares in the facility or institution should be like the care at home. And now we are changing the standard of the building or arrangement of the room in the facility to be more home-like facilities. So we think that's the important thing in our policy.
I think for the pro of the institution-based services, I think if you need the special care, you need to institution-based service, and it's costly. I think we know that. And for the community-based service, I think for the end of life, maybe most of people want to have a palliative care as the home or something like that.
There's another question here on how do you ensure sufficient public funding for long-term care?
Okay, this is not a question for the Ministry of Health. Actually, it's a question for the Ministry of Finance. But I think from a financing standpoint, one thing that I personally do believe in, having had some experience in healthcare financing, is that actually a co-payment component is quite important to allow your services to be sustainable. I don't think the intent is for us to shift the burden of care to the low income, but rather a co-payment prevents people from overutilizing services. And that's why, at least in the Singapore experience, almost all our services have a co-payment component, even if it's a small component of the overall healthcare costs. For the very, very low income, we have a safety net called MediFund that can cover that co-payment component, but it's really reserved for those who are very low income. And our overall approach is to try to keep healthcare costs as sustainable as possible, because we know that long-term care is something that you'll need for a long period of time.
Yeah, the sustainability, financial sustainability of long-term care services is a really big challenge in Japan. But we have to keep the level of the premiums at the affordable level for everyone, and that's a really difficult task for us. But one of the measures is, as I mentioned earlier, there are really big rooms to improve their productivities. Actually, in the care facilities or at the care service providers, they are doing their work, frankly speaking, in very old style, like handwriting of the record or something like that. So I think first we have to think to improve the productivity.
I wanted to add a little bit, which is maybe challenging for some of you, not only at the country level, but maybe also at the regional level. I think if we start to look at the problem from a broader perspective and factor in the real costs that occur for people and the real improvements that we might have if we employ the missing 8.2 million long-term care workers, then we might come to another public funding situation. We might have more funds available that we need.
So any further questions from the audience?
Thank you. My name is Nagase. I'm from Inclusion International. We are persons with intellectual disabilities, family members, and support people. And we are part of the disability community, and we find our participation in this exercise very useful and very interesting opportunity for us to learn. My question is it regards the relationship between the long-term care and disability-specific services. The representative of Japan mentioned that the long-term care services in Japan is different, has a different track with disability. But I would like to ask the other representatives from Thailand, Indonesia, and Singapore, how are you seeing the relationship between long-term care services for the elderly and the independent disability-specific services? And of course, the disability community includes young and old. Thank you.
So in Singapore's case, there are two different ministries looking after two different groups. The Ministry of Health looks after the elderly who may have disabilities, while the Ministry of Social and Family Development looks after people with disabilities who may not be elderly. So from a governance perspective, there are two different policy intents to serve two different groups. But at the service provision perspective, where there are possibilities for service provision to be more efficient, I think the Ministry of Health would work closely with the Ministry of Social and Family Development in service provision. So one example is that for home-based care, because we have home-based care providers who provide services to the elderly, and they can also extend their services to people with disabilities, they have now offered to do so for the Ministry of Social and Family Development. So we have extended the service provision not just to elderly, but also to people with disabilities. This applies to all other settings as well. If we see opportunities where it is more efficient, where we can lower costs by having just one part of the government provide those services, I think we'll try our best to do so, so as to keep things efficient and to keep things sustainable throughout. Yeah.
In Indonesia, actually, in the past 5 years, the policy for disability and also the elderly is one combined policy, that we have to protect people with disability and the elderly. But then it become the part that the regulations on the disability is even more, stronger than the regulatory framework on the elderly. Because in the old regulatory framework of the elderly, we only treat the elderly as like an object of the development, while in the regulatory framework for the disability, it's already been changed into become more active partners of the development. We are actually looking forward for the more stronger regulatory framework for the elderly. By revising the old law, so become more dynamic. And our national strategy that we are building here is still in the level of the presidential decree, and hopefully, like within the next 5 years, it will be stronger. So actually, we have two major policy on this disability, also with the elderly. The minister that taking care of, the main minister that taking care of this are still, I think, the same Ministry of Social Affairs.
For Thailand, we have the universal health insurance that the elderly and the disability can access to that their health care. And as I mentioned before, we have the fund for the local health fund at the community level that for the frail elderly and the disability also. So maybe that is just scale it up to for the another community, because now we have launched only 54% of the sub-level. So now we have to scale it up for the full country, for the whole country.
Thank you very much. We have two of our panelists who have to make a big rush to the airport now. So I want to thank everybody, and I also want to say that I think that it's been a very interesting sharing of experience and also the framework and overview that Zenia gave us. This is an issue that is not going to go away, and there's an urgent need to really be thinking very creatively and concretely here in this region, and to be learning from each other as we go along. And the rapidity of policy development right now and the need for evidence and good approaches on the ground is really what's needed. So I hope in 2 years, when we come back to APSP 2021, we're able to have 15 countries up here sharing our experience and thinking more about how to develop in this area. So thank you.